Hello and welcome again to another episode of Sacktown Talks. I'm your host, Jared Blondin, and today we're joined by special guests Monica Davalos and Adriana Ramos-Yamamoto with the California Budget and Policy Center. Hey guys, thanks for joining the program, and what's going on?
Hey, thanks so much for having us, inviting the Budget Center to come talk to you today about our recent report. We're so excited to join this conversation today.
Yeah, it's kind of interesting time of the year right before May Revise comes out to kind of dive into the budget and see what we'll all be preparing on. I see you guys have come out with a report dealing with certain issues surrounding COVID-19, healthcare, kind of racial equity. Can you kind of tell us a little bit about the report and kind of its findings?
Sure. But before we dive in, in case some of the audience members are not familiar with our work, I do just want to explain a little bit about what we do at the Budget Center. We engage in research and analysis with the goal of improving public policies that affect the social and economic well-being of Californians with low and middle incomes. So we cover a wide variety of issues, including education, employment, and housing. And I specifically focus on health. So as you mentioned, my colleague Monica Davalos and I have recently co-authored a report called Confronting Racism, Overcoming COVID-19 and Advancing Health Equity.
No, that's great. Thank you for that background there. I jumped the gun a bit. So, I guess digging into the report, COVID-19 has exposed, a lot of these inequities we have in society and brought them to the forefront. Can you kind of, dig in and kind of tell us some of your findings and how COVID-19 has brought these kind of to the forefront?
Sure, I'll start, and Monica, if you'd like to jump in, you can of course jump in. So in our report, we highlight the racial disparities in COVID-19 case and death rates, and we do an adjustment for age for those rates, and to really learn more about the disparities that are pretty wide. We found that as of at least late January of this year, Native Hawaiian and Pacific Islander Californians, as well as Latinx Californians, experience the highest rates of COVID-19 infections and deaths. And this is a result of ongoing racist policies and practices. So we say that in the report that these inequities are not by accident, but really by design. And what we mean by that is throughout history and even today, policymakers and other individuals with power have successfully implemented social policies and practices that benefit white people and block people of color from opportunity. And this is essentially structural racism. So we look at these disparities and we ask, why do we see, these disparities? And some organizations or other articles will point to underlying health disparities, but why do we see those underlying health disparities? So we're really digging in deeper and understanding structural racism that's at play. And so our report includes a lot of specific examples. I know we're going to dig a little bit deeper into those, where from the moment a policy was conceived, the intent was to prevent or block Black, Latinx, American Indians from high quality housing, healthcare, employment, and education, and the ability to build wealth. And all of those have direct implications on the health of families and individuals and really do play into this context of COVID-19.
Yeah, that was one of the interesting things. We've had various members on, and the one I remember the most is Assemblywoman Cristina Garcia kind of telling us about her district and the number of COVID deaths and how the hospitals were so full in her district. Yet, in other districts, you didn't see the same, number of cases or number of deaths. So kind of one of the things they pointed to was, the air quality and some of the underlying health things. I guess, a lot has been done, recently to try to confront these things. But I guess, is it too little too late, or kind of what are some of the main contributing factors you guys have seen recently kind of bring these issues out?
There's been a lot of work to improve health outcomes at the population level. So population health outcomes. So we can sort of talk about a lot of different examples. You also mentioned earlier that the environment also has an impact on people's health, right? Where people live, where people learn, play, and age all have an impact on health. And I think that while there has been a lot of work to improve, I'm sort of dancing around this term, the social determinants of health, there's a lot more work to be done. But if I can just unpack a little bit on the environment, since you brought that up, just the idea that everybody deserves to live in a healthy environment. But the reality is that communities of color, particularly Black, Latinx, Californians are more likely to live in neighborhoods that have poor air quality and live in closer proximity to hazardous waste sites than white Californians. And that's what the research shows. And also Black, Latinx, and Asian Californians are more likely to be exposed from pollution like vehicles. And I do just want to go back to the earlier point that I made, that this is not by accident. Environmental factors are deeply rooted in racist policies and actions, such as government-supported housing, which I know Monica can elaborate more on, discrimination, the segregation of communities, unequal distribution of power, and disinvestment from communities. And while there has been a lot of work to really address, environmental racism, there's a lot more to be done. There's a recent study actually that found an association between long-term exposure to air pollution and a county's COVID-19 mortality rate. So all of these, toxic or unhealthy conditions are really harmful to health, and disproportionately so for Californians of color. And it also increases the risk of severe illness from COVID-19.
Housing is something that has been very on the forefront of the governor's office on issues, surrounding the state of California, a lack of housing, homelessness. What are some of the issues you guys are seeing specifically in regards to housing, and how can we kind of start fixing this kind of lack of housing?
Well, I think that's a very big question. If I can chime in now, how to fix the housing crisis in California, right? That's a little bit bigger than the scope of our report here. But what we, really wanted to highlight was really the fact that racist housing policies are really kind of at fault and at the core of why we're seeing some of this housing crisis and why we're seeing higher COVID-19 infection and case rates, particularly in communities of color, right? Because we know that these racist policies have really longed and largely blocked people of color from obtaining high quality housing and stable housing in the first place. And, we can talk about some of the specific examples of that if you want. Why don't you draw out some of the examples so that our listeners can understand in detail, like what are some of these policies, and that will lead us on a discussion of how to, fix them. Yeah. So we take a little bit of a historical approach, right? But we can think back to the beginning of essentially U.S. policy, right? With the systematic displacement of indigenous peoples that consisted of the forced surrender of land, relocation, and eventual genocide of indigenous peoples. Right. And then we fast forward a little bit and we can explicitly look to racially restrictive covenants and exclusionary zoning ordinances that were crafted and implemented with the explicit goal of creating segregated communities. And lastly, and also another well-known one is also redlining of predominantly Black and Latinx communities, which was a federally backed law that California also upheld, where communities of color were redlined and deemed hazardous or very risky for mortgage loans. And these effects are still seen today because families of color have some of the lowest rates of home ownership and generational assets. And within these same communities, they also lost that capital investment that would come from building up that type of asset. Fast forward to today, right? This is why the majority of California renters are people of color, and, not having that type of stable housing these people, because compounded with a variety of other factors that we can go into, right? Like education, employment, their health. They tend to live in more lower quality housing, which also has negative health effects, both in the sense of chronic health conditions and poor mental health conditions.
I guess, this is, I guess, something that's been tried to, be solved in the past, right? You had the Unruh Civil Rights Act. I know when Jess Unruh was speaker, zoning and housing was an issue he took up to try to, break up some of the things you're talking about. I guess, what are some of the, policy failures that we've seen here in the last 20 or 30 years that I guess have led to this to continue to today?
I think it kind of goes down to the point of our report, right? I think policymakers have still not acknowledged that racism is at the core of a lot of the problems that we have today, and is at the core of why we're seeing a lot of these racial health disparities and pretty much disparities across the board, not just in health. And that's why, right, our report is really pushing for policymakers to declare racism as a public health crisis, because in order for, our lawmakers to really acknowledge a problem and really be at the forefront and create actual solutions to them, they have to acknowledge what the problem is and call it out for what it is.
Adriana, you have anything to add to that?
Oh, just that I felt like, Monica had outlined various housing policies that have resulted in inequitable outcomes for families of color in California. And of course, there are a lot of other factors that go into, income, employment, poverty, and health, the idea about the social determinants of health, right? But I think she mentioned a lot of various policies that were rooted in racism that I would consider failures. I think it's safe to say that the historic policies that are rooted in racism should be considered failures. To Monica's point on acknowledging the harm that racism has caused on Californians of color.
It's kind of interesting. You guys outline these kind of 6 areas: housing, environment, employment, healthcare, the justice system, education, and they all kind of seem to kind of build off each other, right? That, without a housing in an appropriate area with the appropriate amount of people living in one house, housing affects where you go to school, right? And then, a lack of education leads to, what kind of employment you can get. Our employment here in the United States is tied to the type of healthcare you get. And then, if you have issues, then that's where the criminal justice system comes in. So it's very interesting that you guys kind of pick these 6 factors to kind of, look into and kind of research. And, I guess one system I'd like to talk to you about is the criminal justice system. And that's something that's seen probably the largest reforms we've ever seen in the last 5 to 10 years, where we've, let a lot of people out of jail and we're trying to decriminalize California. Are you guys seeing any positive feedback out of some of these criminal justice reforms that we've seen the past few years of getting people out of incarceration and back to?
Well, I think generally advocates are very, proud of the work that they've also done and helped led that has gotten California to this point, right? I think there is still the need to acknowledge that there's still a lot of barriers for people, even though they come out of incarceration, or even if we lower and, reform our systems. Again, kind of, driving the point home that there's still like racist policies that maybe are not explicitly racist, but when it comes down to it, they are racist. And you can even see that. And even though we're letting more people out of prisons, that doesn't mean they have a criminal record. And that doesn't mean that criminal record prevents them from employment opportunities and housing opportunities, right? Which then feeds into the other issues that we're having that with, like homelessness. If you're incarcerated, it directly ties to your chances of becoming homeless after you're released.
Right.
So I just think we have come a long way, but it doesn't mean that there's not more to be done within this realm.
In your report, you're basically saying, we need to declare racism a public health crisis. Can you explain what does that mean, in your words?
I can jump in. So we think that California should declare racism as a public health crisis, as you mentioned. It's a call to action in the report. We believe that it is an important first step in addressing racism and advancing racial equity in California because, first of all, in order for policymakers to solve a problem, it needs to be defined. And California has yet to do that. And also, declarations are often the first key step in prompting policy action and the allocation of resources to address any major issue harming Californians, in this case, millions of Californians of color. So as California strives to be a place where everybody can be healthy and thrive, then as a state, we need to acknowledge that we have many racist policies that block people from being able to lead a healthy life, pandemic or not. And I should also mention, since you brought this up, that we wouldn't be the first state to declare racism as a public health crisis. So policymakers here have an opportunity to join leaders in some other states, as well as local regions throughout California that have made this commitment to work against systemic racism and build healthier communities.
I guess, and then, I guess in your view, I guess what steps should be taken then after you declare this, public health crisis? Kind of what are some of the first steps you think need to be taken to kind of start addressing these concerns? Yeah,
that's a great question. And I'm sure, advocates and other stakeholders who've been working to advance racial equity would have a lot of other ideas. But following this declaration at a high level, some policies that would help to advance racial equity include, but are not limited to, expanding comprehensive health coverage to all Californians, regardless of immigration status. We can talk more about healthcare if you'd like. Another policy opportunity is to prioritize affordable housing support, which I know we've already covered a little bit, and funding in communities of color, and also removing any sort of employment barriers that prevent Black, Latinx, and other Californians of color from obtaining stable, high-paying jobs. And all in all, I think what we're trying to get at is that we really need to address the upstream factors that put many communities, and specifically communities of color, at risk during health and economic crises in the first place.
Is that something you just mentioned, are these upstream factors? Can you kind of, I guess, identify for our listeners what these factors are?
Yeah, it's sort of getting back to the idea of the social determinants of health, right? The conditions in which people live, learn, work, all impact health. And there's a lot of research that shows that. So when we talk, let me just take a step back, because if we're talking about our individual health outcomes, there is a certain number of factors that are at play there. There are genetics and individual health behaviors, but actually the research shows that more and more, all of these other upstream factors, like where you live, the sort of the air quality, the air you breathe, do you have access to safe drinking water? What kind of schools do you have access to? Do you have access to nutritious foods and public spaces like parks and sidewalks? Those sort of factors is what I'm sort of getting at when I talk about upstream factors, or the social determinants of health that have a huge impact on individual health outcomes.
One thing you, I guess, just brought up too was, I guess, healthcare and providing healthcare to citizens and non-citizens alike. Kind of, what are some of your thoughts and kind of, I guess, costs associated with providing healthcare to kind of everyone statewide?
Sure. I'd love to expand on that. And Monica, if you'd like to jump in, of course, feel free to jump in. So in our report, we talk about various racist policies within the healthcare system. So we state that people of color experience longstanding barriers to health, such as lack of health coverage, limited access to transportation to get to appointments, lack of resources and providers that are culturally competent, linguistically appropriate, and other forms of racial discrimination that happen within the healthcare setting. So even if you are able to, make an appointment and see a provider, what are those interactions like? So I highlighted one example of a policy that creates and really perpetuates racial health disparities. The fact that undocumented immigrants are blocked from comprehensive health coverage through Medi-Cal or from purchasing federally subsidized coverage through the health insurance marketplaces, such as Covered California. And this exclusion has always been harmful, but it is especially problematic during a pandemic because people who have health coverage are more likely to receive preventive care and treatment for chronic healthcare conditions. And so access to healthcare is really, really important for promoting and maintaining good health. And by the way, having a healthy, population, a healthy workforce is beneficial for our economy, right? So health coverage also helps people avoid large medical bills that can cause financial hardship. So that's just one example of many where communities of color have been blocked from quality health. But the reality is that our government, our healthcare systems, research institutions have a history of enacting policies and practices that harm Black, Indigenous, and other people of color.
I guess, have you guys looked at a single payer system or something like that could be used in California?
Yeah, that's a great question. And I guess I will just say, from my perspective, any sort of policy proposal that helps to expand healthcare coverage and ensure that all Californians have access to receiving healthcare coverage for the reasons that I've already laid out would be beneficial to California.
I guess, the next thing kind of to go back to housing, for a little bit, COVID-19 has caused, the ability for people to pay their rent or their mortgages, a great uncertainty. And there's been, forbearances and foreclosure moratoriums, which are set to expire here in July. Kind of what are your thoughts and kind of what are your analysis on are renters going to be able to pay their rent coming up in these coming months, or do you guys think that these moratoriums need to be extended?
I think, and honestly, a lot with these, as a lot of these issues, as you were just mentioning, I think even the single healthcare payer system, these problems have to be handled both at the state level and the federal level. I don't think, Californians are surviving right now because unemployment was extended, right? Both at the state is helping, but also the federal government is helping. They have to keep working in unison in order to ensure, that we don't have even more people of color who were already the most vulnerable before the pandemic, become, even more susceptible to the negative, economic consequences if we don't extend the eviction moratorium and if we don't continue funding unemployment benefits to actually keep people housed.
Yeah, I saw you guys wrote a piece kind of about, I guess, California has 17 million renters kind of facing housing instability and inequality. I guess, now that we're starting to open up and kind of this COVID-19 pandemic looks, there's light at the end of the tunnel. Kind of, I guess, what do you see for the future of these renters and the kind of ongoing housing instability going forward?
If California doesn't begin to take, concrete steps to creating a more equitable California, I think we're going to continue seeing some of the racial disparities that we see within renters right now, right? I think California has these in part because we have racist policies that have, placed people of color in the places to be renters. And kind of going back to the report, I think the first step really needs to be to acknowledge why we even have these problems. And if we don't acknowledge it, then how are we going to take the steps to, begin addressing them?
I guess, is there any part of the report that you don't think we've covered here that you guys would like to kind of bring up on your own right now?
We sort of covered quite a bit some of the various institutions that we've highlighted in the report. So we've sort of gone over through this conversation the environment and housing and the justice system and healthcare. So we can talk more about employment and how racism is sort of embedded there and some of the policies and practices there, as well as education.
Yeah, I guess, something you guys touched upon was employment, I guess barriers to employment, occupational licensing, and the sort where people of certain criminal histories can't get jobs. I guess what additional, areas in employment do you think, need to be addressed to kind of help people of color gain full employment? Well,
I think it would be helpful to just sort of lay out the issues there, right? So in our report, we talk about racist wage and employment policies that concentrate people of color into occupations that are often undervalued with low wages and minimal benefits, and sort of created barriers to economic security.
Yeah, that makes sense. So I guess, people are forced into lower paying jobs because they're not able to get, the right education or opportunities to promote.
Yeah, and that's definitely been an issue during the pandemic. So in our report, we mentioned that Latinx and Black Californians are more likely to be essential workers, often the first to lose their jobs during these economic downturns and experience higher rates of unemployment. And this goes back to what we were talking about in terms of housing and rent, because having a lower paying job makes it difficult to afford rent and utilities and other necessities like childcare, groceries, and other unexpected expenses. And it also makes it difficult to obtain healthcare. So yeah, it's been something that has been an ongoing issue for Californians of color to sort of overcome, especially during the pandemic and economic recession.
Right. And I guess, education, that's been extremely difficult this time of during the pandemic with, the digital divide, the lack of broadband in some areas. Kind of what are some of the, the issues facing these communities, in the education system?
Yeah, well, I think you've already sort of mentioned it, right? The digital divide and sort of these inequities in access to broadband internet and devices to help connect students to school during this period where many schools are still operating under a remote environment. And that's going to, there's some research on this topic already, but on how that's going to impact educational disparities that already existed prior to the pandemic and widen that achievement gap. Because it's a major barrier for students, and particularly students of color and students and families with low incomes during the pandemic.
It's interesting how they all tie together. If our listeners want to, I guess, read the report and learn more, can you tell us, where they can access it and where to find more information?
Yeah, well, they can find this report as well as all the other great work we do on our website, and that's at calbudgetcenter.org. And the report, again, is called Confronting Racism, Overcoming COVID-19, and Advancing Health Equity.
Well, thank you, Monica and Adriana, for joining us today and kind of going through the report with us. Is there anything else you guys would like to get out there before we go?
Just one thing that comes to mind, and something that, other people have been saying, is just that we can't go back to the same California or, back to normal, because that way with life was not working for so many people in our state. So the one other point that I'd really like to just restate is that state leaders can create a California with anti-racist policies that really value the life of every Californian and ensure that every everyone has the resources that they need to be healthy and thrive. And again, it starts with declaring racism as a public health crisis.
No, well said. And I think this kind of COVID-19 has kind of given us all a reset, and hopefully we take advantage and take to heart what your report has said. So thank you so much for joining us and filling us in. Look forward to reading it more in depth.
Awesome. Thanks so much for having us.
Thank you.
Dreamers.